Welcome back to the Alliance Goal Digger podcast. I'm Rachael Auyer, the host, and I am so excited to have Onny Mbagwu here with us. I'm going to get her to say her full name in a minute. Onny has been with Alliance for 4 years, and I'm so excited to allow her to share about a passion she has. She loves pediatric patients, and she's going to talk about helmets. If you have ever wondered, does my kid need a helmet, or what is a helmet? This episode is for you. Without further ado, welcome Onny.
Hi. Thank you so much for allowing me to be here. My full name.
Thank you.
It is Adeze Onny Mbagwu.
It's a beautiful name, and I'm grateful that you allow me to call you Onny because I struggle with saying all those beautiful names. And I wondered if you could kind of shore up this conversation, let parents know what we're going to talk about and why you're excited to be here.
Of course, I think we're talking about cranials today, and it's very important to know about cranials and just like early awareness because it allows parents to have conversations with their pediatricians to ensure that their child is getting the appropriate evaluation and care needed at the right time. So it's very important that cranials are just talked about with your pediatricians and then eventually talked about with us orthotists as well.
No, that's great. I think the title of the podcast is Demystifying Helmets because I think there's a lot of confusion surrounding when it's appropriate, when it's not. And early detection is so important for overall healthcare of little ones. I wondered if you wouldn't mind sharing a little bit about yourself to get us going.
Yeah. So I've been with Alliance Prosthetics and Orthotics for about 4 years now. I started off as a resident, and then after my residency and completion of my exams, I became a full licensed and certified orthotist and prosthetist. Whoop, whoop.
Yep.
I love working with all types of people from babies to geriatrics, but I do love working with babies very much because of their innocence and of course their smiles. And it's always an honor to kind of help be a part of babies' lives and just be at an important stage of their lives too. And I think that there's something special about just helping a child have a chance to grow up and be healthy and supported and loved as well. My parents used to always say that it takes a village, and I usually carry that with me while working with children. And so, caring for children is always like a team effort. You're working with us orthotists, prosthetists, providers, doctors, therapists, and of course, working with their parents and families. So it's always going to take a village to help them grow up and develop well.
That's such a good point. I love your passion for babies, and that's why it was obvious to us all that we needed to get you on the podcast to help all of our families get to know you better. Onny has been practicing with us for about 4 years, and she has specialized in making sure babies have good visits with us. And obviously, she does have some super tricks with keeping babies still and happy during all the scannings and different things, and we'll get to that. But let's go ahead and start with the first question. Typically, a baby with a little bit of flatness could qualify for a helmet, but sometimes we simply don't know if, in fact, they need a helmet. Why don't you walk us through how you know and what are the first steps in evaluating?
Yeah. So a lot of babies, they have some type of flatness or asymmetry in their head shape, especially if they spend time lying down. They're newborns, they don't walk yet. So they're on their backs for most of the time while their skull is still soft and still developing. And so mild flattening is usually common. It can improve with growth, repositioning, tummy time, a lot of parents do. But if the flattening is a little bit more significant and it doesn't improve with repositioning or tummy time, that's when it's time to check with your pediatrician or kind of get some advice from the doctor to assess the head shape. It's important not to panic during that time, but definitely checking with the pediatrician is important. For a lot of the babies, the first step isn't like a helmet at all. It's just more repositioning, tummy time, like I said, a lot of just alternating the way baby looks and turn their heads too, and sometimes physical therapy if needed. Sometimes we can tell if they have what we call torticollis. It's the tightness on their neck. And then sometimes going to physical therapy first, they will diagnose them with torticollis too, which often travels with a flat spot. So that's why like starting early and knowing where to go, knowing who to see is super important.
And about what ages should parents, or in the months, kind of start noticing or looking at their baby's heads? Obviously, they're looking at their child all the time, but to be a little bit more, I wonder if this is normal.
We like to start the cranial helmets from 4 to 6 months of age, but as much as they can, if they see anything abnormal, it's always a good idea to talk with the pediatrician about it.
At their normal checkups, just asking. How would you, if you were a parent or from your practice talking to many parents, how do they begin that conversation? And then if in fact a helmet is recommended, what should they do next?
So when a helmet is recommended, if the flattening is in the moderate to severe range, or when repositioning therapy has been given a try and the shape is not correcting on its own, that's when we're probably wanting to just like talk with the doctor. The doctors are referring parents to physical therapy, and sometimes they're referring them to us as well to take measurements. Very important with timing here, because like I said, 4 to 6 months, that's when it's the best time to do a cranial helmet. If it's under 4 months, typically repositioning tummy time could help correct the head shape. But once they hit 4 to 6 months, repositioning tummy time doesn't work as much. So that's probably when we're wanting parents to get in with a pediatrician, get in with a physical therapist, so that they can just have their head shape assessed and refer them to us or any orthotist, prosthetist as soon as possible.
I was wondering about the head shape. So you talked about measurements. What are we measuring? Because by my eye, I might see a flat spot and it's not really improving. But what do you use to determine if, in fact, a child is eligible for a helmet?
So there are 2 different type of measurements. One we call is the cephalic ratio. What we're measuring with the cephalic ratio is the length versus the width of the head. And what we're looking for is usually called brachycephaly, and that's if both sides are symmetrical, but the back or the posterior side of the back is just more so flat. And then we're also measuring the diagonal difference between both sides of the head. We're looking for the diagonal difference of it, and we're also looking for the cranial volt asymmetry index. And that's mostly seen with plagiocephaly, or babies with plagiocephaly. And that's if one side is a little bit flatter than the other side of their head. And then sometimes they can have a mixture of both, which is just brachycephaly with asymmetry.
So, Onny, this sounds very scary. And because we do it all the time, it doesn't really sound scary to us. I really want to speak to the parent who is wondering, if my child has something inside those ranges needing a cranial remolding helmet, could there be other issues going on? Is this simply head shape, or is there other things that I need to be concerned about?
Yeah, so I think that's why it's super important to meet with a pediatrician and make sure that your baby is attending all of their checkups and follow-ups. There is a condition called cranial synostosis where the sutures or the seams of the skull fuse earlier than they should. It's a different situation, and it's typically managed medically or surgically and not really with a remolding helmet. The good news is it is uncommon, and it's something that a pediatrician or specialist screens for during those appointments. So when a family comes to us, that medical question has already been sorted out with their pediatrician. We handle the positioning shaping of the head shape. So like I said, the brachycephaly, the plagiocephaly. Another thing we may take a look at is what is contributing to the flat spot. For babies with asymmetry, sometimes they have what I talked about before, the torticollis, which is the neck tightness. And it's hard for babies to turn their head in certain ways, which can cause them to kind of lay flat on that one side. That's where physical therapy usually comes into play.
That's so important to know. So typically what we're seeing is simply the head shape. We are not dealing with any of the other issues. And if you're coming to us for a cranial remolding helmet,
yes,
those other things have already been talked about in your pediatrician appointment. And I know we talked about this, but it's so important to just reiterate how important it is to meet with your pediatrician at
yes,
the milestone appointments that are scheduled, and to not miss those, and to ask these questions during that time.
Of course, very, very important.
All right. So now we're moving to your pediatrician has decided that you need an evaluation because potentially your child might fall into the range of needing a cranial remolding helmet. What should parents do first?
So after you've talked to your pediatrician and they've either referred you to physical therapy or referred you to us, you want to get in touch with us, or if your pediatrician has let us know to call you, we'll probably call you as well too. But we want to get scheduled for an evaluation here at Alliance. When you're called, you're usually talking to someone who's been through this before, who knows what they're doing. And we want to make sure that we're just getting you set up for an appointment here at Gainesville, Mulberry, or Brazelton. And then step 3 is the evaluation, where we do our measurements, and sometimes typically we're doing a scan as well too. And we'll talk more about scans and all of that next. But after the evaluation, step 4, we're working through insurance and authorization so that there are like no surprises with the financials and all of that. And then step 5 is where we fit the helmet. And then we usually see you for regular checkups as the baby grows. And whenever we're done and we see that the head shape is more so in that normal range, we always want to celebrate you. And so we'll always do the gold digger process, and you'll ring the bell, you get t-shirts and all of that fun stuff too, because we want to make sure to let parents know that, hey, this is common, this is correctable. But at the end, you did a good job of being compliant, keeping the helmet on, and just going with the treatment. So
Oh, I know. So have you ever had a patient come in for an evaluation and decided this is not appropriate, that a helmet is not something the family needs to move forward with?
Yeah, so there's many times where the baby's head is in the mild shape, and sometimes we just recommend going back and doing more repositioning. And then there are times when parents come in just to evaluate, and the baby doesn't even need a helmet. They're just seeing like little mild flat spots or something that looks abnormal, but it really isn't. So that's why we like to take the measurements, and we like to do a lot of those evaluations.
And those are completely free. So I think that's just a misconception that you can come in, you can have your baby's head measured by a professional orthotist who is licensed and able to practice here in Georgia. And one thing that I've seen, as you all have worked with so many families, is sometimes you track with families until it's absolutely necessary. So you guys will have follow-up evaluations to see if, in fact, the repositioning was effective.
Yes.
What is the time frame for that typically? If a patient comes in between 2 to 3 months because they want to come in before that 4-month kind of window, what would you say is a normal cadence to, if in fact you're not quite sure your child needs a helmet, you've done some repositioning, what does that timeline look like?
So if they've come in a little earlier, like maybe if they're 2 months or 3 months and they haven't been doing enough repositioning, typically we want at least 2 months of repositioning before we can even consider doing a helmet for them and all. And especially if they're in a mild category, we want to make sure that they've had at least 2 months of repositioning on there. And then once we realize that 2 months in and their head shape is still flat in one spot, that's when we're wanting to make sure, okay, we've gone through repositioning tactics, we've gone through tummy time, all of that. And I think right now a helmet is the best option because there's nothing else we can do that will help guide that patient's growth or the baby's growth to correct their head.
That's so important. And so when you have met with parents who have moved forward with a helmet, you're typically taking measurements and you're tracking that at each appointment after it's delivered. I wondered if you could go through how you take those measurements at evaluation and then help families understand what you're looking for.
Yes. So we talked about getting the cephalic ratio and also the cranial volt index. We're taking measurements, like I said, from the width and the length of the head, the diagonal difference of the head. We keep all of those measurements, keep them in our notes. And then at the next appointment, we're comparing measurements. We're seeing, has the baby had any change? Has the circumference changed as well too? If we see that there's a change in circumference, there should be a change in numbers as well if the helmet is doing what it needs to do. So for instance, if a baby is at, we take it by millimeters, if a baby is at 455 and the next time we see them, their circumference is at 472, that's a big change. So we want to see that in our diagonal difference numbers. We want to see that in our cephalic ratio numbers. And then we want to show that to parents, letting them know, hey, the helmet is doing its job and it's doing the correction that it needs. Additionally, if we do see that the circumference is 455 and it's 456 the next time, then we know that, hey, the helmet is still doing the job. Baby is just taking a little bit longer to grow. Don't panic. It's okay. We're still working on, we're just still waiting for a growth spurt for the baby so that the helmet is doing that guided growth.
I think that's such an important point. As a mom, sometimes you might be concerned if in fact the helmet is going to cause a baby's head not to grow. And also as a mom to big-headed children, this is not the, I know that does get everybody to laugh. My youngest, as a child, everybody would talk about how big his head is. And it was very big. And his dad, being an orthotist, was constantly measuring it. But we're talking about ratios, not actually how big the head is.
Exactly.
And so I wondered if you could talk about how parents can view cranial remolding helmets, what it's actually doing. It's not constricting growth. What is it really doing?
So what it is, it's guiding the growth. So we have the helmet, areas where they're already in what I like to call them bossed. They're already bossed, and areas of flatness. So in the helmet, we want to hold on the areas that are already bossed. And then the rest of the helmet has voids in between the spaces that are flat. So what it's doing, that every time your child grows, the helmet is just guiding the growth so that it's rounding out the head shape. So it shouldn't hurt the baby. There's padding inside. It should just more guide the growth. So it's guiding it, making the head shape more round. So there's no pain or anything typically, and we'll talk more about this as far as like checking the skin and all of that. But main thing that the helmet is doing is just guiding the growth.
It's so important. So not only are you looking at the baby and seeing with your own natural eye, you are tracking all these numbers, which is so important that families are consistently coming to their follow-up appointments once the helmet is delivered. I didn't know if you could talk about why putting numbers matters so much. Why do you care so much about this baseline versus remeasuring?
So a couple of reasons. It takes the guesswork out of the decision, and we can clearly say like where a baby falls and whether the helmet is justified or needed. And then two, it also gives us a baseline. Every time we remeasure during a treatment, we can show the family the numbers moving in the right direction. And so parents, they love seeing that. And it turns, I think it looks better into here's the proof it's working. It justifies the documentation with insurance, which makes the whole process easier.
Oh, that's so important. I was wondering if we could shift about, as you know, in our field, we have a lot of technology innovations and things, and helmets, they also have experienced a lot of innovation over the time. And I wondered if you could talk about 3D, traditional, and then even when we were prepping, she threw me in, I forgot we do the clear ones and why we do those. And so we have lots of options for families. And I just wanted to give you the freedom to talk about that. This is really clinician directed, not so much parent directed, based off of your years of practice.
Of course. And I think technology has always been growing and growing, has been different and has been improving, but we have some pretty cool technology to help us. So what we use is a smart scanning device to capture a 3D image of the baby's head using, I like to call like a balaclava type head shape liner sock, but it's called the Smart Sock. So we put that over the baby's head, and then we place small landmark stickers on specific areas of the head so we can identify the important anatomy and measurements from the scan. And so now technology is there, but babies are still babies. And so it's usually the part where parents usually see a different side of me because I'm like trying to get the baby's attention during the scanning. And so sometimes I have to like sing the alphabet song to the babies, and sometimes I have to like make silly noises and stuff. And then there's even a time that I had to sing a song called Chicken Nuggets to babies just to get their attention. But all we want to do is just make sure that we get the perfect scan for them. So whatever we do, we kind of do what we need to do to get that scan. For the helmets, we like to use Ortho America Star Band helmets. We find that they're very precise, customizable, and comfortable for the babies as well too. We usually have the ability to adjust it as the baby grows. That's why we like them. And then most importantly, it's a one helmet treatment. Like you only need just that one helmet. The same helmet is used throughout the treatment process, and we don't need to like purchase a new helmet if the baby is growing, or parents don't need to go through insurance again for a new helmet. So the one helmet stays throughout the whole process.
That's awesome. I'm sorry. I'm so intrigued about the chicken nugget song. I need you to sing it for us. We need the chicken nugget song. I pretend I'm a baby and sing the chicken nugget song.
So I sung the chicken nugget song, and after that, every follow-up appointment, I had to sing the chicken nuggets. So it goes, it goes, chicken nuggets, chicken nuggets, chicken nuggets, chicken, chicken, chicken.
I love it. And so this song you personally created to get babies' attention. Why do you need the baby's attention? What is going on with this sock? Now, I hope Laine, our producer, is going to put up some pictures of kiddos getting scanned, because these sock things, they look so cute. I mean, they're so cute, but they are wiggly. And you have to put them in the little bumbo, and there's a whole process because we need it to be exact.
Exactly. Yep. So it's very important that we capture all the landmarks. We capture their head shape because we want everything to be correct. We want them to have that helmet that is fitting correctly, and that it's going to help them guide their growth in the future too. So with the whole treatment process. So it's very important that we do what we can, that we sing if we need to, if we use toys if we need to, just to get their attention so we can capture all of that.
And I know you typically never have a baby who cries or is upset because you're perfect in every way. However, is it common for babies to be uncomfortable during this process?
I am definitely not perfect. But yes, it is very, very common for babies to be very uncomfortable with the process, especially just putting caps on their heads and then just somebody random touching you and evaluating the head. But like I said, I try my best to make them feel comfortable, play with toys, sing them songs and all, so that they know that they're in a safe spot, and then they can let their little personality shine through.
Oh, that's so important. And I think one thing to reiterate is that this at no point is harmful for the baby. This is completely rated for the appropriate medical provisions, and that their crying is more agitated or annoyed. There's absolutely no reason that they are in pain whatsoever. Correct?
Of course, yes.
I just want to reiterate to all those moms who see their baby with their little cap on, listening to Chicken Nugget. They're typically smiling when they're listening to that song, I'm sure. Now, we have traditional as well as 3D, and then also this clear one. Can you describe when it would be appropriate to use the traditional versus 3D, and why you would recommend a clear helmet?
Yeah. So Ortho America, they came out with their 3D helmets, which are a little bit lighter weight and more comfortable than the traditional ones. And they also have ventilation hose, which honestly helps a lot because babies like to sweat and they can get pretty sweaty in them. Typically, we're using the traditional helmets for babies who are more in the severe range, depending on the case, because like I said, we want to have that adjustability for them so that we're able to grind off the foam of the helmet so we can give them more space to grow and round out that head shape. Both helmets, they typically work well with what we're trying to achieve. The main difference parents knows is that the 3D helmet, they only have 4 colors versus the traditional helmet. They have like a variety of different colors and patterns. But at the end of the day, we are just talking with parents about what the best helmet treatment would be. Additionally, we like to do what we call is a starlight helmet. It's the clear helmet. Typically, if babies are having like super sensitive skin, we would do that helmet because there's no foam in there. It's just the plastic and the baby's head contacting it. It does not hurt the baby at all. It's a Cerlin plastic. So it still should be comfortable for the baby, but it's just more important to have something that doesn't mix with like the sweat and the foam and all of that can cause rashes for babies who have sensitive skin. So those are the 3 options we typically do. There are a variety of different styles of helmets too. Like there are like a bivalve. When I say bivalve, it's a front and a back, and you kind of open it that way for babies who have more of the longer shaped head, what we call scaphocephaly or dossiocephaly. And then there's like different helmets that we use for cranial synostosis as well. That's post-surgery.
That's so helpful. And I do want to reiterate, because here at Alliance, we are patient-centric. And so you get the freedom to pick what helmet is best for the baby's diagnosis.
Yes.
You're not told which ones you have to use. You look at a person or the baby and say, this is what's best. Has that been your experience here? And parents know that they can speak to you. There's a collaboration.
Yes.
So I wanted to talk about how you identify when traditional 3D sensitive skin. It's typically a conversation with parents. What would a parent expect if you are making those decisions?
So I want to always make sure that parents are involved with the decision-making processes. As a specialist in the field, I want to make sure that they're knowing that these are the different options they have, but which option will be best for their child. If parents are more focused on like the patterns and all of that, we get it, but we want to make sure that we're getting the right treatment for their child. So of course there is parent collaboration. We're talking with parents, pediatricians, physical therapists if needed. But at the end of the day, we're specialists in this field because we want to help and we want to make sure that we're providing the right treatment that we know works and that we know will get them to their goal.
And typically, how long does it take from evaluation, if it's a traditional evaluation, getting the helmet around 4 months? What should parents expect treatment timeline?
So typically from evaluation, next steps is we're sending the order to the doctor to get that signed. Shouldn't take too long for us to get that back, but once that gets back to us, we send that to insurance. Now, insurance is the only thing we can't really control how long they take, as much as we can. Once we get that insurance authorization, we're calling parents to come back in with their babies for a scanning appointment. Now, it can take anywhere from 6 to 8 weeks. It may take more, it may take less, depending on insurance and getting that paperwork from the doctor. But as much as we can, we're trying our best to keep parents updated with the process, to keep doctors updated as well, too, to make sure that we're having that paperwork in hand so that we're not wasting any more time with getting the baby fit with the helmet.
And because it varies so much, it's hard for us to know if, in fact, the policy requires prior authorization or if it doesn't, which is why it's hard to give an exact timeline. I wondered if you could talk about what things you've seen go smoothly and the success stories with parents who have helped advocate for their child with their insurance plans. If you had any experience, what would they need to have on hand, or what steps did they take in order to ensure they had success with getting coverage?
So main thing, of course, is seeing a pediatrician. You want to make sure that you've seen the baby have seen the pediatrician, so that if we're needing pediatricians to update their notes stating that they need a cranial helmet, but typically they do because they've already been seen and they're being referred to us. Just making sure that their insurance is still active, and just kind of talking with the insurance about coverage too. Sometimes I tell parents, like, you can call your insurance, kind of let them know that we're wanting some authorization, see if they can speed up the process sometimes. But typically just making sure you're talking with your pediatrician, having all of that in hand too.
So important. And I wondered if you wanted to talk about when you have had any out-of-pocket cost or different things, surprises of how would we know that's happening and what steps we take here at Alliance to minimize that?
Yes. So before we move forward with anything, we always want to have financial discussions. So after we get the paperwork from the doctor and after we have gone through insurance and we have authorization, we at Alliance, we are calling parents to let them know if there's anything they owe or if insurance covers everything. So we want to make sure parents, there's no surprises with financials and that they know everything from head to toe before we move forward with that helmet, because of course we're wanting them to have that treatment and have opportunity for their baby to have that helmet, but we don't want them to be surprised with any costs that they weren't aware of. So it's very important that we have those financial conversations with them beforehand before we move forward with anything.
No, I think that's such an important point. And the other part is that this is custom. So it is going to be fit to their child's head. There's no returning it. Obviously, customer patient satisfaction is non-negotiable here. So we work together to make sure we're on the same page.
Yes.
I wondered if you could talk about what it looks like on the day of delivery.
Mm-hmm. So typically day of delivery, we are taking measurements to kind of see if there was any change in their head from the last time we've scanned. When we're scanning at the scanning appointments 2 weeks before, we want to make sure that we're fitting the helmet 2 weeks after that scanning appointment so that the helmet is still fitting properly. Anything more than that, the helmet may not fit properly and we may have to look into either redoing the helmet and all of that. So we want to make sure that we're coming 2 weeks after that scanning appointment. During that delivery appointment, we are, of course, taking the measurements. We're fitting the helmet. We're making changes if needed. We're talking about cleaning instructions, wear time. We're also talking about things that parents can use to wipe the helmet down, to wash their hair. Of course, things that are hypoallergenic and safe for babies to use so that it's not causing rashes. And then just letting them know that we'll be seeing them every 2 weeks too. It's very important that we leave the helmet on for 15 minutes as well to check for redness. If there is redness on the head, then we make those necessary adjustments to grind off foam or make more adjustments to the helmet.
And you just led perfectly into the next questions I have is, so how long does a baby have to wear a helmet? What is the protocol? What should I be expecting? And then at appointments, how long do appointments typically take?
Yeah, appointments are usually 1 hour. Sometimes they can go from 30 minutes to an hour, depending on if adjustments are needed. The baby has to wear the helmet for a full 23 hours. It is 23 hours because we don't know when babies grow. They just grow. So we want to make sure that we're capturing all of their growth while they have that helmet on. So we want to make sure that they're having the helmet on 23 hours, 7 days a week, all day, every day. We typically tell parents to take the helmet off for physical therapy because, of course, if they're doing stretches and all of that, we don't want that to hinder the process. But we're also taking the helmet off if they have fevers because we don't want them to overheat in the helmet. And, of course, babies first, children's first, health first. So if they're having fevers and they're getting too sick or anything, we tell them to take the helmet off. PT, take the helmet off. Other than that, keep the helmet on.
I know it's been a challenge as we've seen some cutie pies who, unfortunately, their parents didn't keep the helmet on. What happens when you don't keep the helmet on?
So if they don't keep the helmet on, unfortunately, there is a lot of that growth. They'll grow in circumference. But their head is just going to grow the same way. It's no more guided growth that's helping to correct that head shape. And then sometimes they may grow out of their helmet and it may require us to get a new helmet, or it means that helmet that they have no longer fits them. And
there's nothing we can do.
Exactly, because we can't do.
And typically insurance doesn't cover a second helmet. That's
They
out
won't.
of pocket.
They won't cover.
And so that's why it's so important for the 23 hours on, except if baby has a fever.
Yep.
And during PT.
Yes.
What about skin issues? Can you talk a little bit about what you've seen and recommendations, and if in fact baby is having some breakdown?
Yeah.
How can we avoid that, and what to do if in fact a family is experiencing skin issues?
So what we tell parents all the time is that they get 1 hour off for breaks for bathing, cleaning the baby, and just checking their head. Checking their head would include checking for redness on their skin. If there's redness anywhere on their skin that the helmet is contacting and it's lasting for 30 minutes to an hour, please contact us immediately so we can get you in the next day. If we need to shave some foam off, or even if we need to adjust the helmet, we want to do that as quick as possible. We want to make sure that the babies are not uncomfortable in the helmet as well too. So redness is usually that first indication that they might be growing into the helmet, or that something is just going on, like there's too much pressure. And there are times where we can see like so much rubbing that it rubs raw, or so much rubbing that it rubs blisters. So anytime that happens, it means that the redness has stayed longer and there has been no attention to it. So that's why we always tell them, as soon as they see any redness that's lasting 30 minutes to an hour, you contact us. Now, if there's pinkness or slight redness and it goes away quickly within 15 minutes, or it just goes away quickly in general, that's okay. That's just the baby's head getting used to the helmet, of course, and then the helmet is contacting where it needs to contact. And if it goes away quickly, that should be okay.
Oh, that's great to know. And which leads me to the next point, is that once the helmet is delivered, we have a very strict protocol here of how often babies need to be seen for follow-up appointments to avoid any of these skin issues, right?
Yes. Mm-hmm. So typically we're seeing babies every 2 weeks initially, depending on how old the baby. If they're a little older, we can move it at every 3 weeks or every 1 month. But every 2 weeks is very important as when they're young, because we want to make sure that they're growing super fast. So we want to make sure that they are getting the right adjustments needed to accommodate that growth.
And I think one thing to point out is that you're typically treating that baby the entire time unless there's an emergency.
Yes.
So why don't you talk about our other team members and how everybody loves treating babies, and that sometimes if it's an emergency, how they'll see a different clinician?
Yeah, so sometimes if they cannot get in with the same clinician that they've been seeing, all of our clinicians here are specialized with babies. We all love babies, so we want to make sure that we're getting the right treatment for them too. So sometimes they may be scheduled with another clinician, and just as much as I'll take care of the baby, they will too. And so they'll make sure that they're reading previous notes, previous adjustments notes. They are also asking us questions if needed, but typically they're just reading the notes and they're making the necessary adjustments.
And typically that only happens if, in fact, there's an emergency or vacations, or parents can't make their regular appointments, because at their eval, then delivery, then we make all of these extra appointments at the end to make sure that everybody can be there at the same time. However, we do offer flexibility. I think that's one thing we want to reiterate is we're here to help parents, not to keep them locked to a certain clinician and schedule. It's based off of their schedule as well.
Of course.
And now I wondered if we could change up the conversation. We've got to talk about Onny as the clinician, but maybe we could talk about Onny as a person. What is some things that we need to know about Onny? So we're going to do a rapid fire-ish. Why did you choose prosthetics and orthotics? What made you want to be a crazy CPO?
I think, and I always say this to everyone because I definitely think it's true, I think God put me in this line of work. Just from how I started, I really was planning to go to dental school. And then at the time I got accepted into one of the schools, I was going to do my master's program and then go to dental school. And then I also got accepted into a P&O school. I didn't know much about P&O yet. My mom was actually talking to my brother about it. And I was like, that sounds fun. Let me look into it a little bit. And so I was kind of weighing my options with going through a master's program and then going to dental school, or going to PO, prosthetics and orthotics. So like researching more in prosthetic and orthotics. I love being hands-on, doing hands-on work. And then also just seeing families relax once they realize that everything is going to be okay. You know, it's just very heartwarming to work with people, and being able to also use my hands to create something detailed that we can give to parents and of course other patients as well, that would help them with the hardest parts of their lives.
That's beautiful. And we love having you a part of the team. Onny came on as a resident, and to continue to have her a part of Alliance has been a major privilege. We also here at the podcast want to know, what is your favorite part of a helmet day for you?
Of course, it's just seeing babies smile and laugh.
Singing the chicken nugget song.
Singing the chicken nugget song. You know, it's just like babies' innocence it just makes your day. It's just very nice to see. I love when babies smile and laugh. And it's just really something special about being able to make them comfortable enough that they start to relax around you and they start to play and show their little personality. So I just love, there's always what people say that hearing a baby's laugh is just like some type of dopamine, or to everyone. You just hear babies laugh and it automatically makes you happy. It brightens your day. So I think that's one of the reasons why I really like doing a lot of cranial helmets.
No, you do a lot of cranial helmets, and you do have the best chicken nugget song. So I wondered, in all of your helmet expertise, you have seen a lot of different decorated helmets. Which one has been one of the best that you've ever seen?
There was one baby, and I know parents set it all up and everything, but there was a decal or a sticker with a wrench, and there was words that said "fixing my flat." And I thought that was so cute. And I don't think I'll ever forget that helmet because it was just so nicely done. It was really nice. Baby, of course, graduated from his cranial helmet, and I know parents are keeping that helmet somewhere. But that, and then I've seen parents turn their babies' helmets into full-on football helmets, which is also really funny and really cute too. I just love seeing like how creative parents can get, and just how they get comfortable with turning something like more of this treatment process into something fun, and that they can show to everyone around the world, or not around the world, but around their community, that this is okay, that it's going to work out well.
And I know with the 3D helmets, we have 4 colors. Can you describe the 4 colors?
So 3D helmets, there's a pink, it's called Passion Pink. There's a blue color. There is what they call a polar gray. It's kind of like a lighter gray. And then there's also a darker gray. So those are the only 4 colors with the 3D helmets. But like I said, 3D helmets, they have the ventilation hose. So it still has less sweat.
Yes, I definitely love that Ortho America came up with a 3D option for parents who want less sweat. I also wondered if you could talk about your side gig of singing. It's not on our script. I wanted to surprise you and at least talk about Onny as the before our podcast started, if you didn't know this, we are not professionals here. We are working on it. And Onny is the one who taught us how to mix, how to use these amazing microphones, headphones. Even when she came in, she's like, this is the left, this is the right. So Onny, talk about your singing and why you love singing and how long you've been singing.
That definitely came as a surprise. But I've been singing all my life. I started singing when I was 5 years old, writing music when I was 9. And just throughout my life, I've been writing my own music. I've been producing my own beats as well. I used to think that singing was the only job ever I would do until I known about orthotics and prosthetics. And reason why I love orthotics and prosthetics a lot, I'm gonna get a little passionate. Reason why I love orthotics and prosthetics a lot is because that was another career path that I felt very passionate about other than singing. So it was going to be singing throughout my whole life until I known about orthotics and prosthetics. But yes, I still sing on the side. It's
we
what
all
I love
enjoy
to do.
it. She has got an amazing voice.
Thank you.
If in fact you can find her online, you should go find her music. I'm so proud of her. And also the other thing I wanted to bring up is family. Onny is someone who loves family. She comes from a big family. She is passionate about her family. I know her mom is listening. So I want you to have an opportunity to give a shout out to your family and your bestie, your mom.
Of course. Shout out to my family. I think my parents, both my mom and my dad, they've been so supportive of me, my siblings, since, of course, they're going to be their family. But just with my music in the beginning, they were very, very supportive of it. And my mom has just been there throughout everything. I call her my momager. So she's definitely the person that does like music with me. But my dad is also there, my number one fan, and my siblings as well. Super supportive. We're all super close. When we were young, we used to fight. But now that we're older, we're just like super close, very close. And we do a lot of things together. And so I think it's very important to have my family around me. I think it's very important for everyone to have family around. And even if it's not immediate family, like I said, it takes a village. And so like people around you, friends, workers, and all of that, I think it's very important to kind of build that community with people because it just makes life easier, makes you happy. And that's what we want.
And I think it translates so beautifully into your practice of treating babies and families.
Yes. Mm-hmm.
And I think your love for family just continues to bless all of our patients. And I know she gets a lot of good reviews online. So Onny, I was wondering if you could, at the close of our podcast, give a recommendation or let families know something that in all of your practice you think is so important.
So my biggest advice is just breathe and trust the process. And I also want parents to kind of hear me clearly when I say this. Please do not blame yourself or feel like you did something wrong because your baby has a flat spot. Positional head shape changes are very common, and it happens for a lot of reasons, even if you try to be attentive and loving parents. And it's not a reflection of anything that you did or didn't do. We usually just walk you step by step with everything and nothing is rushed, but we just want to make sure that parents know not to blame yourself at all for it.
Yeah, in light of that, I think that's such a beautiful reminder that that's one reason we're here, is to partner with parents, and that if they're here helping their child have the head shape that is best for the child, that's already a reminder to them that they're doing the right thing, that they're good parents. I know we've had lots of variety of parents come through here and lots of different feelings of helmets, no helmets. I thought maybe we could also close with the Gold Digger Banquet and how important it is to attend that.
So I think having the Gold Digger Banquet, and I think it's a wonderful idea that Alliance has created. Miss Rachael holds dear to her heart. I love it so much. that banquet, I think it's very important that we have that, because we want to make sure that we continue to motivate our parents, motivate our patients as well, to continue reaching for their goals. And when they did reach for their goals, and when they have achieved it, we want to make sure that they're celebrated heavily.
I was thinking you could talk about recognizing their inherent value and worth, and that's our mission. So when you've taken those goals and you've achieved, you're remembering something bigger than just mobility or head shape, that we all have inherent value and worth.
Yeah, I definitely think it's important to know who you are, and knowing that you are worthy of doing this, and that you're worthy of getting back to the life that you were doing before, or just getting back to being normal again. Everyone is different. No one is typically like very normal, but but at the end of the day, you are a person, and we want to make sure that you feel like that. We want to make sure that you're getting the treatment that you need, that you're getting the love that you need as well too. And that's why we love celebrating the goals of every patient.
And I think the other part that I love that we talked about is your family. And so many times patients come in and become a part of our family here. Mm-hmm. And I know you're already thinking about a couple, because you love your patients. And because of our type of medicine that we practice, we see each other a lot. Yep. Patients typically come in here and we have regular appointments. What would be some things that you would encourage patients who are considering doing a helmet, or they're just on the fence, and kind of giving them that last encouragement?
Yeah, I would just say just to ask questions. I think that's the hardest part, is just like getting up and asking questions. Once you ask questions, I think everything else is going to come easily. You'll get the answers that you need. You'll get the advice that you need. And I think that's just very important, to just ask questions. There are no dumb questions at all. And then once you get those questions, everything else should be easier to go through.
That's so good. And if you come to the banquet, you can see us all dressed up very nicely and dancing, and maybe Onny will even sing for you. Thank you for joining us for the Alliance Goal Digger podcast. I'm so glad you were here to learn about helmets and why they are important, and what process you can take. If in fact you're considering a helmet, please reach out to our office at 770-679-3090, and we'd love to schedule you for a free evaluation. Thank you so much.
Thank you.
Were you inspired or challenged today? If so, connect with us. Follow the links in the description box below. We want to hear from you. Until next time, thanks for listening to the Alliance Goal Digger podcast.